to your body when you start taking omega-3 every day for 30 days. Or even when you consume more omega-3 rich fish. Did you know that these simple nutrients can transform your health? In this video, I'll share everything about omega-3. If you have a fatty liver, can omega-3 worsen or improve the condition? When is the best time to take omega-3 to ensure maximum positive effects on your health? What benefits can omega-3 bring to you? I'll discuss the top 7, and there are many more. Does taking omega-3 capsules pose any risks? Yes, there are risks and nobody talks about them. Maybe omega-3 isn't suitable for everyone. Watch until the end before heading to the pharmacy. And if you still decide to buy, how do you know if the omega-3 is of good quality? How many capsules should you take daily? What's better, eating sardines or taking fish oil capsules? Prepare to be surprised. But before you dive into the video, subscribe to the channel to not miss our health tips, ring the bell for notifications, and, most importantly, share this knowledge with your friends and family. Because when it comes to health, sharing is caring. Now tell me, have you ever taken omega-3 capsules? Did you experience any benefits, or do you prefer eating more fish? Omega-3 is an essential fatty acid, meaning it's crucial for our bodies, but our bodies can't produce it on their own. It must come from the diet. There are 3 main types of omega-3: EPA, DHA, and ALA. Omega-3 can come from both animal and plant sources. Plant sources like flaxseed, chia seeds, walnuts, pumpkin seeds, as well as spinach and Brussels sprouts, are rich in alpha-linolenic acid, ALA, and omega-3 fatty acid. If you consume eggs, especially those with redder yolks, or deep-sea fish like tuna, mackerel, salmon, sardines, anchovies, trout, and cod, they're rich in omega-3 of the other 2 types, EPA and DHA. Yes, alpha-linolenic acid can be converted into EPA and DHA, but it depends on each individual's body. Some people are efficient, but most can't convert ALA into EPA and DHA effectively. The most reliable way to get EPA and DHA is to consume them directly and not rely on the body to convert them. So, I ask again, are you getting enough omega-3? I hope so, because about 70% of the world's population doesn't consume it adequately. Worse, there's an imbalance in the current diet between omega-6 and omega-3. In the past, when consuming beef, it was rich in omega-3. The same goes for chicken, pork, and fish. These animals didn't eat much feed or grains, they grazed. Today, if you buy fish, even salmon for example, most of them contain very little omega-3 because they get it through their food. Chicken eggs contain more alpha-linolenic acid than EPA and DHA, except for fertilized ones or eggs from free-range chickens. So in the past there was a balance. The diet had a 1-to-1 ratio of omega-6 to omega-3. Now this ratio has increased significantly. It's 4:1, 7:1, 10:1, 20:1. Omega-6 is found in vegetable oils, soy, corn, sunflower, and is seen as pro-inflammatory. It increases inflammation in the body. Omega-3 is anti-inflammatory. If you have a lot of inflammation, joint pain, chronic fatigue, stiffness, swelling, skin changes, digestive problems, sometimes the problem is the high consumption of omega-6 in the current diet, which exacerbates inflammation, and the low consumption of omega-3, which is an anti-inflammatory. So we need to return to the 1:1 balance as before, or as close to it as possible. Exactly for the benefits of omega-3. Now, what are the 7 benefits of omega-3 for your body? The 7th benefit, omega-3 can benefit your eyes in 3 ways. The most important is that omega-3 fatty acids help reduce the risk of macular degeneration, a leading cause of blindness in adults. A study showed that people with the highest level of omega-3 in their diet had a 30% lower chance of developing macular degeneration. But it doesn't stop there, as omega-3 can also help reduce the risk of high eye pressure, which can lead to glaucoma. And if you have very dry eyes, know that omega-3 can also help prevent and treat dry eye syndrome, where the eyes don't produce enough tears, leading to uncomfortable symptoms like itching, burning, and redness. A study showed that among 32,000 female participants, those who consumed more omega-3 had a 17% lower risk of suffering from dry eyes. I started with eyes, but now let's move on to the brain. Benefit 6: Omega-3 can help your brain improve memory and mood. An increase in omega-6 in the diet was accompanied by an increase in depression. The brain is rich in fat. About 60% of the brain is fat. And it has a lot of DHA. It's one of the most important fats in the brain, helping nerve cells function better, increasing signal transmission, protecting against oxidation, aiding in neuroplasticity, and helping you learn new things as you age. Therefore, it can improve memory. It can improve your mood. But it can also prevent cognitive decline. It improves symptoms of anxiety, depression, and other psychological issues, because it can reduce brain inflammation and also protects against brain degeneration, slowing the loss of neurons. It can improve attention deficit. The fifth benefit: omega-3 can help improve triglyceride levels. If you have high triglycerides, one way to reduce them is to increase omega-3 in your diet. Both ALA, which comes from chia, nuts, and flax seeds, and fish, and omega-3 capsules can significantly reduce blood triglyceride levels. There also seems to be a slight increase in HDL cholesterol, which is good. Reducing triglycerides can reduce the chance of developing fat plaques throughout the body and hardening of the arteries, but also the risk of developing pancreatitis, which is very severe, and it can also help treat fatty liver. Yes, there is a study that shows that following a diet rich in omega-3 reduces hepatic steatosis. So if you have a fatty liver, it's helpful to include more omega-3 rich foods on your plate. The fourth benefit, which I mentioned earlier: omega-3 can reduce inflammation in your body. Omega-3, especially EPA, has anti-inflammatory properties. So DHA acts more on the brain and eyes. And EPA reduces inflammation, but all three. ALA is also important. If you suffer from a lot of joint pain, omega-3 can help. There are studies showing that even fish oil supplements can reduce pain, joint sensitivity, and morning stiffness in people with rheumatoid arthritis, which is essential to reduce the use of pharmacy anti-inflammatories, which can attack the kidneys, among other things. Benefit 3: it can reduce blood pressure. If you have high blood pressure, increase fish consumption as well as walnuts, flax seeds, and chia seeds. Several studies show a reduction in blood pressure in people following the Mediterranean diet and the DASH diet, both rich in omega-3, but also in people taking fish oil supplements. And see how interesting it is that the effects of fish oil may be greater in people with moderate to severe high blood pressure. Of course, in this case, you'll also need to take blood pressure medication. The second benefit of omega-3: it can improve your skin. You'll look more beautiful from the inside out. Omega-3 positively affects the skin-gut axis, a key factor for radiant skin, as it can increase good bacteria in your microbiota. Omega-3 can also regulate skin oiliness, improve skin hydration, reduce the risk of acne, and diminish signs of aging. Omega-3 can also help soften rough and dry skin and has a soothing effect on skin irritation and inflammation. So, consuming more omega-3 is an excellent strategy for having healthy, glowing, and younger-looking skin. Benefit 1: omega-3 can reduce the risk of heart disease. Let's go: reducing blood pressure, improving triglycerides, increasing HDL, and reducing inflammation. All of these reduce the risk of heart disease. But there's a catch: although research shows that people who eat more omega-3 in their diet, fish at least twice a week, have a lower risk of dying from heart disease, taking fish oil supplements seems to have little or no benefit. It doesn't bring any benefit to heart health. There's only one exception here: the more concentrated omega-3, which requires a prescription, so you can't go to retail outlets and try to buy them. You won't be able to do that, so I want you to answer, is it better to eat sardines or take omega-3 capsules? What do you think? An article this year in Frontiers in Nutrition suggests that eating sardines 1 to 2 times a week, which is likely, may be more beneficial than taking an omega-3 capsule. Sardines are seen as a functional food that, besides omega-3, contains other heart protective elements like calcium, potassium, magnesium, zinc, iron, taurine, and arginine, which can improve heart and blood function. I repeat here. The best way to consume omega-3 is through diet and food: sardines, anchovies, even eggs enriched with omega-3. And omega-3 supplements outside the diet, right? Do they pose risks? They do. A significant risk that nobody talks about is the increase in arrhythmia that seems benign but isn't. How to know if omega-3 is of good quality? First, observe the color of the bottle. Ideally, a dark bottle that doesn't allow light entry. Avoid transparent bottles because fish oil is highly susceptible to oxidative damage caused by light. The more ambiguous, the better. The second thing to look at is the expiration date. The farther from the expiration date, the better. The same thing: oxygen, time, light, denature, and make omega-3 rancid, which, instead of having an anti-inflammatory effect, can have a pro-inflammatory effect, inflaming instead of removing inflammation. How much omega-3 should a capsule contain? DHA and EPA. Add the two. If using supplements, you should take more than 1 gram, 1,000 milligrams of omega-3, DHA and EPA. Read the label. For 2 capsules, it contains 800 milligrams of EPA and 400 milligrams of DHA. So, 2 capsules of omega-3 a day are enough. In other places, to take the same dose, you may have to take 4 or 6 capsules. There are 3 main sources where you can buy omega-3: fish oil, krill oil, and algae oil. Fish oil is the cheapest. Krill oil, a crustacean that looks like a small shrimp living in very cold waters, and algae oil is the most expensive of all, despite being the most environmentally friendly. The best time is to take the capsules with meals, as they will be better absorbed with the fats from the food, and they also have the ability to reduce digestive side effects such as reflux and fishy taste. Choose between breakfast or lunch to avoid reflux, which can harm sleep. Also, don't buy supplements for more than 3 months. As I said, they can spoil, not at the pharmacy, but on your shelf. Did you like the video? Until the next video.